Quality health care is a necessity for quality of life. It's a basic need for people to have good health if they are to function well in a society. The Catholic Charities Healthcare Network was started back in 1984 when Cardinal Hickey saw the need to help the low-income and uninsured. He called the Catholic physicians, and through that meeting, about 140 physicians started the program. And currently, we have over 300 physicians who see our patients in their offices, in their hospitals, and wherever they serve. And what we do at the Healthcare Network is like we are a liaison between the volunteer providers and the patients. We work with 22 clinics at 42 sites. When patients go to the clinic and see their primary care providers, the clinic will evaluate the patient, and if there is any need for specialty services, they send the patients to the Catholic Charities Healthcare Network. What we do every day is to call, make appointments. We go through their referrals that are submitted, prioritize them based on the patient's needs, and we try as much as we can to ensure that they all have access to their programs.
My partnership with Catholic Charities started essentially when I started practice. From the very beginning, I personally have wanted to have some outlet to be able to give back and to provide service to some underserviced population, and Catholic Charities has really been that great avenue that has allowed us to do that.
I believe it's important to provide this type of service because I believe that quality healthcare is a right. It's a basic human right. To be able to provide these services for people who may not otherwise be able to afford the type of healthcare that we provide here. It's an honor, honestly. I'm someone who comes from a humble background, and I literally had to work myself up to where I am today. And I didn't always have access to health insurance. So to be able to do for women what other people did for me in the past, it feels as a way of being able to pay it forward.
Once somebody is referred to us through the healthcare network, they are just a normal patient to us. There's no differentiation between a patient coming from the healthcare network and any other patient.
Patients who are part of the Catholic Charities Network want to be included in everything about their healthcare and not treated any differently than any other of our patients. We don't have separate times, we don't have separate facilities. Anyone who needs care calls into the office, gets a standard appointment, and then the entire process from not only the non-surgical treatment through the surgical treatment and post-op is exactly the same as any other patient that would walk into this office today.
Mi nombre es Marta Ramos. Gracias a Caridades Católicas he recibido 3 cirugías y le agradezco mucho a Caridades Católicas porque ellas me han apoyado mucho desde cada cita que tengo, cada vez que necesito un referido, y me mandan al hospital MedStar, Georgetown University Hospital, y me han ayudado todo el tiempo.
Martha Ramos is such a wonderful lady that I met through Catholic Charities. She had previously undergone surgery back in 2006 at another institution for a tumor in the brain. And that particular tumor had regrown and it had become more aggressive. It was in an area that, among other things, controlled the movement of her body on the other side. So I knew that the first step in her care was to be able to remove this tumor and remove it safely without hurting her neurologic function, allowing her to return to normal function, normal life. And so we were able to do that with certain microsurgical techniques. We were able to remove this tumor.
Y a las personas que pertenecen a la Caridades Católicas, yo les doy las gracias. Les deseo muchas bendiciones porque la verdad que me siento muy agradecido con ellos, de estar con vida, estar con mis hijos. Yo no estaría aquí contando mi historia si no fuera por la ayuda que he tenido con Caridades Católicas. Me siento muy feliz de estar con vida y ser testimonio ahorita de la gran ayuda que me ha dado Caridades Católicas.
One of the core values as a physician is to be able to serve others, to be able to dedicate your life to helping other human beings return to normal life. We do that regardless of their means, their insurance, and for many of these patients who really just don't have access to health care, it's wonderful that we have this access through Catholic Charities to be able to help them.
There's nothing more rewarding than taking someone who is really can't get around and can't function and get them back to essentially what is a normal life. The reward, seeing it personally, has been tremendous, and the appreciation that that patient feels has been probably one of the more rewarding things in my career.
We are so honored and appreciate our patients, who entrust their care to us. We see ourselves as lifesavers. And it gives me joy coming here every day knowing that I'm going to do good for somebody. I'm going to help somebody gain back their health. I'm going to help somebody feel good